Well, good morning, everybody, and welcome. We appreciate everybody coming today for this press conference being held by our county commissioners here in Susquehanna County. I'd like to introduce some of our guests that are here today. We have Senator Gene Yaw, we have Senator Lisa Baker, we have Representative Tina Pickett, Representative Jonathan Fritz, we have our Sheriff Lance Benedict, our Pathonetary Jan Krupinski, and our two commissioners, our chairperson, Elizabeth Arnold, and Judy Herschel. So I want to welcome everybody here again today. On May 1st, the governor announced the first 24 counties to open. We knew that we were on the bubble, but believed we had the right numbers to open. Unfortunately, we were disappointed to hear that we didn't make it. We encourage our constituents to hang on, that we can work hard and work through this, and we can reduce our numbers even more and have a good shot at next week's openings. About 30 minutes before the governor's announcement last Friday, I found a post on Facebook as to which counties would be opening. I hoped it was wrong, but it wasn't. Why do we as county officials find out his news release from outside groups instead of from his office? We were outraged to find that we were still in the red. Our numbers were down to less than half of what we needed. No explanations, no phone calls, nothing. Today our 14-day total is 0. We had no new cases overnight. So if you go back to 14 days, we're at 0. They say there are other criteria, but then they don't share this information. We have no reason as to why we're not open. They don't realize that a vast number of our people use the hospitals in Binghamton or Scranton. Not to say that we don't have great health care in Susquehanna County, we do. Endless Mountains healthcare systems, Barnes Caisson, NEPA, and many clinics and private practices. Again, the people making the decisions in Harrisburg about our county have no idea about our county, and if they are calling, they are definitely calling the wrong people. So I'd like to start out today with our first speaker as Senator Gene Yaw. Senator.
Thank you. I saw a quote from a healthcare person over the weekend, and I want to make sure I get this right. In retrospect, it will likely be seen at best as an overreaction, and at worst, costly folly. Now, look, I am not akin to a climate denier when I say that the COVID-19 is not a serious problem. It is a serious problem. It's a very serious problem. But for who? For whom? I guess it should be for whom. We know where the problems are in Pennsylvania, and we know what age group is affected. The median age of deaths in Pennsylvania is 84. 84. Just think about that. Now that's, we all feel bad for our friends and loved ones who happen to be in those age ranges, but that's a fact. For some reason, we happen to overlook that in 2017, 2018, there were 80,000 deaths in the United States as a result of the flu. 80,000. Now, I know we're in that range right now with COVID-19, but my point is, are we in an area where there is really something strange? And here's the other fact to consider about 2017 and 18. We had a vaccine then. We had 80,000 deaths with a vaccine. Now, I don't remember, we for some reason, we're all upset about this, and I want to talk a little bit about science. We kind of forget there's 600,000 people every year that die of a heart problem in the United States. There are 500,000 cancer deaths. 2 years ago, there were 5,600 people died of an opioid death in Pennsylvania. Last year, the rate came down. We only had 4,500 deaths last year from opioids and heroin overdoses. All I'm saying is this, let's just put everything kind of in perspective here. And I think that that is something that I'm talking to the administration about too. Let's get things in perspective. At one point, there's no question about it, 2 or 3 months ago, we didn't know anything, where we were going or what was going on, who was targeted or what the problems were. We know that now. We know that 65% of all of the cases in Pennsylvania come out of where? Nursing homes. Who's in charge? Who licenses nursing homes? The Department of Health. The very people that are telling us all the things that we should be doing out here, what are they doing? Why do they have 65% of the problems in Pennsylvania? As I said, I'm not questioning the fact that for some of our population, this is critical. But that's where we should be focusing. I'm old enough and I look around this room and there's not enough people here with white hair, frankly. But I remember when I was growing up and I was in school, if you got measles, mumps, or chickenpox, what happened? You know what happened? There was somebody from the county Department of Health came around and they put a notice on your front door that your property, my parents' property, was quarantined. If you want to go online and look it up, there are people selling these old quarantine posters from Pennsylvania. It's great. I mean, you name it. That's what we did. We quarantined the sick people. We didn't quarantine the people who weren't sick. So I guess, one of my questions is, how do we get here? And, the only answer I can give to that is fear. And it's been promoted. It's promoted to the point where fear in Pennsylvania is very, very detrimental. People are afraid to go out. They're afraid to go out of their houses. You talk to any hospital, the hospitals are scared. They're concerned because people that need health care won't go to the hospital. They have a heart problem, but they're afraid they might get COVID-19. And statistically, we know now that it's like it's like 0.25% is what your chances are of dying of COVID-19. Now, I just mentioned that is, some background. The Pennsylvania residents and citizens of Pennsylvania, me included and all of you, when somebody tells you we have a problem, fine. We'll work at that problem and we'll follow what the rules are and we'll try to do the best that we can, provided that what you're asking us to do makes sense. Okay, nobody knew 2 or 3 months ago where we were, where the problems were, who was to be the most affected. The key to this whole thing is logic. And we will do things as long as there's logic. And I agree with Commissioner Hall. Yeah, Susquehanna County in 14 days has had 0 cases. So what is the logic behind saying you have to be shut down? You should probably go directly to green. You shouldn't even go to yellow. You should go to green. When the logic ceases to make sense to people is when, it's just like across the street over here in the green, there are people that have a rally or a protest or whatever it is. It's like, does what we're being asked to do make sense? And I gotta tell you, where Susquehanna County is placed in this whole picture does not make any sense. I thought it was interesting that Commissioner Hall said the way he found out about it was on Facebook. I don't know whether my colleagues found out about the new listing as to what it was, how how they found out. I know we did not get any direct notice. I didn't. I found out about it from my daughter, who lives in Kansas City, who saw it on the internet. She said, oh, here's a new listing. I said, well, thank you for telling me. The logic that's not involved here is unbelievable. It's just like, we weren't notified. We're not notified of what the factors are for waivers. I had to tell you, this is the most closed administration that I have served under, and I served under 3 different ones so far. And, you know, getting information, finding out what the facts are, let's talk about logic. It's not. My favorite term is that they've adopted the cookie cutter approach. Is like, okay, this is what it is. If you have these things, then we're not considering the facts. If you happen to be in a county which is in this region or this area, don't raise any logical questions. Don't tell us that you haven't had any cases in the last 14 days, because you're in that area, you're going to be included in the red. Because we might have to think a little bit to put you in yellow or green. So we're going to work very hard, just telling what our story is here. I cannot see any justification, as most of the people can't anymore, for absolutely destroying the economy of Pennsylvania, and in particular this region and Susquehanna County. It just makes no logical sense anymore. That's the problem that I face, that Senator Baker faces, and that the representatives all face when we go back to Harrisburg, is how do we get logic inserted into what this administration is doing, and to the people of Pennsylvania, and especially the people of here in Susquehanna County. So thank you, and hopefully we're all safe, and good luck to everybody. Thank you.
Thank you, Senator Yaw. At this time, we'll have Senator Lisa Baker speak. Senator?
Good morning, everyone. I want to thank the county commissioners for including all of us in today's conversation. Unfortunately, many people have said to me, lines are being drawn, you're either for safety or you're for big business. And I don't know anybody who isn't for safety of lives or the safety of livelihoods of those individuals. Unfortunately, last week, a Harrisburg reporter posed a question: which of your family members are you willing to risk so the wheels of capitalism can start again? Your daughter, son, a sibling, a parent, a spouse? I can safely answer that for all of us. Not a single person in that list. But which of my family members, I would say, would be safer in a small, independent operation, or a sole proprietorship, or a small enterprise that have actually been hammered by this business closure? We've traded Main Street businesses for big box and Amazon. Safe to say many of us would believe our family members would be safer in a small enterprise that's following safe guidelines, CDC guidelines, CISA guidelines. No one is suggesting that we put anyone we care about at risk. What we also don't want, as Senator Yaw and Commissioner Hall said, arbitrary designated areas over community circumstances. And the numbers bear that out. Arbitrary designated areas over our own community circumstances here in Susquehanna County. The real concern is that state officials do not understand how difficult the recovery will be for our rural area and how the disadvantages and consequences deepen each week. They see people here, I hear from them frequently, no evidence of a plan for how the state intends to help replace what's being lost and how progress will appropriately occur. When businesses announce permanent closure, when people's lives are devastated. So people want a clear idea as to when they can move forward safely, with the emphasis on self-reliance rather than a deepening government dependency. People don't trust the wisdom of state government, a government who reopened Pittsburgh and Allegheny County before Montrose, New Milford, and Great Bend. They don't see or hear equal consideration of our rural perspective. So we'll go back to the original question, why not Susquehanna County moving forward appropriately? We've had no real answers, and today is about asking the questions and trying to ascertain those answers about fairness, transparency, and accountability. Senator Yaw spoke about those in nursing homes. Those individuals, 70% of the people who've been greatly impacted are in nursing homes. And last week, the Secretary of Health said she's robustly considering options for greater testing when the industry, the nursing home industry, is asking for universal testing of all individuals and workers in these facilities. At that time, I said the time for robust discussing is over and the time for action is now. The idea that a testing site is at the Mohegan Sun Arena with the expectation that it is serving northeastern Pennsylvania counties. Nobody here in Susquehanna County is driving an hour to the Mohegan Sun Arena. I've asked the department, why didn't you deploy mobile testing units to help our small rural counties, going to the locations that are the highest risk? I got no answer. So today we're questioning, we're seeking answers, and we're seeking fundamental fairness for the people in Susquehanna County. If you can move Allegheny County and many other counties to a yellow status, looking at our numbers, the question is, why can't we? Thank you so much.
Thank you, Senator Baker. And now we'll hear from our House Representative, Tina Pickett.
Thank you, Commissioner, and thank you, Susquehanna County Commissioners, for bringing this together today and standing up for Susquehanna County. There are so many words to be said, but it's time for action. It's all about jobs, it's about livelihoods, and it's about our health. And I firmly believe that we can manage and monitor all of those together. I believe the governor's decision to not move these citizens of Susquehanna County forward is not based on verifiable facts. It's not based on reasonable assertions. It's wrong to not be in open communication with these Susquehanna County commissioners. No one knows their county better than they do. They can plan, they can monitor, and they can safely make these decisions for Susquehanna County. People here are smart, they're capable, and they're able to create and implement a path forward. Governor Wolf is absolutely wrong on Susquehanna County. This county needs to be allowed to move forward. Thank you.
Thank you, Representative Pickett. And now we'll hear from Representative Jonathan Fritz.
Thank you, Commissioner Hall, and thank you, Commissioner Arnold and Herschel, for having us, and the fellow Susquehanna County officials for being here today. Mr. Governor, my Susquehanna County brothers and sisters are a truly good and altruistic people. When we were advised to stay at home and shut our businesses, we complied. When we were told to make sacrifices, we complied. When waivers were granted to some and denied to others, creating winners and losers, we remained cooperative. When big box stores stayed open and thrived, while mom and pop stores and Main Street businesses wilted, we shook our head. But we remained cooperative. Mr. Governor, the time is now. The urgency at a spike. Businesses are announcing permanent closure. My neighbors, well known to be hardworking, proud, highly productive people, are in dire financial straits. Our rural economies, frankly, are on life support. Mr. Governor, the data substantiates and the circumstances clearly illustrate we must reopen Susquehanna County. Mr. Governor, we demand freedom. We demand liberty. Simply examine the numbers and do what's right for Susquehanna County. Thank you, friends, and thank you, media, for being here.
Thank you, Jonathan. Now, we'll have our Sheriff Lance Benedict just say a couple of words if you'd like.
Again, if anybody has any questions, I would be happy to answer those, but right now I'll leave it to you folks and to the commissioners.
All right, at this time, we'll hear from our chairperson of the commissioners, Elizabeth Arnold. Commissioner Arnold.
It's hard to breathe under there. Thank you, Commissioner Hall. Good morning, everyone, and thank you for coming out. Thank you, Senators and Tina and John for coming in today for us. We appreciate you being here and supporting us. Let me find some glasses. So last week, the commissioners of the county, we were eagerly awaiting the governor's announcement on Friday afternoon. We were hopeful that we would be one of the counties allowed to move into the yellow phase of the governor's plan. Unfortunately, we were not chosen. I actually happened to be on the phone with Senator Baker at the time, about half an hour before 2 o'clock when the announcement was to come on. And I said, Lisa, have you heard anything? Because we haven't. And she said, no, I really haven't. It was just within a few moments into our conversation that Commissioner Hall came to my doorway and said we did not make it. And I said, how do you know that? The governor has not come on yet. He said, it's already been on Facebook. The Pennsylvania Association of Realtors has already announced it and put it out there. I was dismayed. I was disheartened. And I found it to be very disrespectful that it was already out there and we, the county government, did not even know that. So I would ask the governor in Harrisburg for more communication and more transparency, to talk to us, to tell us what's going on. I think the public has the feeling that we know more and that we're not telling them everything. Well, to be honest with you, we really don't. We hear it about the time you hear it on the internet, which is sad. There needs to be more and better communication with county government in Harrisburg. To my constituents, I'd like to say thank you. We have been doing a great job in this county. We have kept our numbers level. We've done very well. When I am out and about, which is a lot less now than it was for the last 4 years, I see people practicing social distancing.